let's begin our case number 1. A 44-year-old man is brought to the emergency department by the paramedics after he was found tumbling and confused at home. On physical examination, the patient appears slightly sedated and admitted to the recent heavy drinking but said that his last drink was 34 hours ago. Okay. He also said that he vomited 3 times. Okay, so we have got one symptom here. He vomited 3 times that morning. He denied the chest pain and abdominal pain. He has a 15-year history of the heavy alcohol abuse and usually drinks 6 to 7 beers a day. CT scan was negative for any mass and lesion and bleeding. So lab findings are given here: aspartate aminotransferase, alanine aminotransferase 18, then lactate dehydrogenase 398. What will be the diagnosis? So from the case itself, we can predict that our patient is alcoholic. He has given the 15-year history of the heavy alcohol abuse. It's given here, and his last drink was 34 hours ago. So, what do you think? What will be the diagnosis of this patient? He has the symptoms of the he was sedated, confused, and then okay. So, what do you think? This is a case of the alcohol withdrawal syndrome. Okay, let's begin. So, alcohol withdrawal syndrome. What is the pathophysiology of this condition? Alcohol. What do exactly alcohol do to our nervous system? So we will see here. Alcohol is a central nervous system depressant that causes neuronal changes, including stimulation of the GABA receptor, that is gamma aminobutyric acid. Repeated consumption of the alcohol desensitizes the GABA receptor. So this is important. Let's highlight this. So repeated consumption of the alcohol desensitizes the GABA, resulting in the tolerance and the physical dependence. So this is one of the main reasons why it's happening. When the person suddenly stops consuming alcohol, the nervous system is hyper aroused. So nervous system is hyper aroused and synapse fire uncontrollably. This result the symptoms seen in the alcohol withdrawal. Increased serum non-epinephrine and altered serotonin level has also been implicated in both alcohol cravings and tolerance. So this was all about the pathophysiology. So this was all about the pathophysiology we have seen. Going to the next slide, we will see what are the symptoms of this condition. So here we have one diagram. So its symptoms are divided into the 4 stages, that is 8 to 12 hours, 12 to 24 hours, then 24 to 48, and then 48 hours onwards. So we will see the symptoms one by one. Okay. So what are the symptoms of this condition? Minor symptoms include diaphoresis. What do you mean by diaphoresis? Diaphoresis means excessive sweating. Then GI upset, that is gastric mobility disturbed. Then patient will have headache, nausea, vomiting, palpitation, tremorlessness. Okay, so going to this slide of this question, we have the symptoms of vomiting. Okay, so patient has vomited and then he had a symptom of confusion. Okay, so these were the symptoms. Okay, then other than this, the patient can have the seizures which can occur between 6 to 48 hours of the last drink. So what was the history of this patient? That he has his last drink 34 hours ago. So it's given here. He has his last drink 34 hours ago, and then he had symptoms of confusion, he vomited, and negative for any mass and lesion. So already we have made a diagnosis of alcohol withdrawal. So these are the symptoms. Then coming to the next symptom is that a visual hallucination. So this is important. Visual hallucinations can occur within 12 to 48 hours of the last drink. So our patient had a history of his last drink 36 hours ago. So he can have the visual hallucinations, delirium tremens. So this is very important. What is delirium tremens? We will see in the next slide. So delirium tremens may occur within 40 to 96 hours. Delirium tremens is nothing but a set of all the symptoms happening in the after alcohol withdrawal. Okay, so this is a stage 1, stage 2. Then in stage 1 we are having anxiety, headaches, nausea. Then stage 2, which occurs between 12 to 48 hours, the patient will experience from the confusion. Then stage 3 includes hallucination, then seizures. Okay. Then post-acute symptoms are depression, decreased energy, sleep disturbances. Okay, so this was all about the symptoms we can see in the patient of the alcohol withdrawal. Okay, going to the next slide. What is delirium tremens? As I have asked earlier, delirium tremens is nothing but the state of all the alcohol withdrawal symptoms. Okay. It's a collection of the severe alcohol withdrawal symptoms that include delirium, agitation, autonomic instability, then tachycardia, hypertension, low-grade fever, diaphoresis. Okay, so this is nothing. Delirium tremens is nothing but set of all these symptoms, and approximately 5% of the patients with alcohol withdrawal syndrome develop the delirium tremens. Okay, so what would be the treatment of this condition? When the patient has alcohol withdrawal syndrome, and how would you treat that patient? So treatment of choice for this patient is benzodiazepines, which particularly we give is lorazepam and diazepam are the treatment of choice for all types of alcohol withdrawal symptoms. So this will cure the patient of the alcohol withdrawal, and this is how we are going to manage. Okay, so we saw the delirium tremens. Then treatment of choice we give the benzodiazepines in this patient, that is lorazepam and diazepam. Then we have seen the symptoms taking place in this patient. Then what is the pathophysiology of this patient? We have seen that the repeated consumption of the alcohol desensitizes the GABA receptor, resulting in the tolerance and physical dependence. And nervous system is hyper aroused. Okay, so this was all about the case number 1. Hope you understood it. Bye.